So thank you. We'll open up for questions.
Thank you, Director Padfield. And now we're available to take your questions.
Thank you, Secretary. Our first question is from ABC 27. Secretary, we're hearing that you moved your mother from a nursing home to a hotel. What message does that send to the thousands of Pennsylvanians whose parents are in nursing homes but may be unable to move them out when the person in charge is overseeing nursing homes and is in charge of the state's response to coronavirus moves out their own parent?
Well, thank you for that question. My mother actually is a resident of a personal care home, not a nursing home, and that is regulated by the Department of Human Services, not the Department of Health. My mother requested, and my sister and I, as her children, complied to move her to another location during the COVID-19 outbreak. My mother is 95 years old. She is very intelligent and more than competent to make her own decisions. I remain committed to protecting residents in Pennsylvania wherever they live and wherever they go, whether it is in a facility that I regulate, whether it is in their homes and their communities, and whether or not they agree with our strategy.
Secretary, from WKOK, with 70% of the state's COVID-19 deaths coming from nursing homes and long-term care facilities, where is our greatest need for improvement in these facilities? Do we need better and more testing, and how long will it take to get to where we need to be?
So I think we are looking at continuing all of the outreach that we have made with these facilities, and we now have the capability in Pennsylvania to do the mass testing that we hope to do. We actually started this last week, and we're continuing to roll that out this week through many of the mechanisms that we discussed. Some of those tests can be done in our state laboratory. Many will be done at commercial laboratories, but we want to test all of the staff and residents in these facilities, and then to be able to congregate them and take care of them with COVID-19 the way they need to be taken care of.
The Associated Press, how many tests a day or a week do you expect the personal care home testing will require? How much will the program cost, and who will pay for it?
Well, we have released an advisory and that we issued to nursing homes today that helps them develop a testing schedule based upon their current situation. For example, if a facility has no cases, its testing strategy is geared to detect any cases early. If there is an outgoing outbreak, then initial testing will occur, and then more frequent testing will be warranted. So it'll have to be individualized to each facility.
Under the long-term care testing plan, what is considered a long-term care facility?
Well, we're talking about congregate facilities such as personal care homes, such as nursing homes, and assisted living facilities.
Regarding the testing in long-term care facilities, how long will this weekly testing go on for, and how much is budgeted to fund this?
Well, so we'll be doing this as long as necessary, and the funding will come, especially if we do it at our laboratory, the funding will come from our resources. And there are other federal resources through the CDC, as well as the resources dedicated by Congress and signed by the President for the states, as well as from FEMA, given the disaster declaration.
From Spotlight PA, why did the state wait until now to implement such a testing plan?
Well, as I've outlined before, really before the last week or so, and last week we started this program, we have not had